Every clinic that has been operational for over 20 years, like Darling Buds Clinic, has a unique DNA. And at Darling Buds Clinic, we are recognized for 5 things. Effective, long-lasting results. We have a huge series of such results, which you can see on the link provided above. And it is only our channel which shows you 10 years and 15 years old results. Results that are not a flash in the pan. Results that are long-lasting. And then natural results. Results even your barber can't tell. Results acquired through cutting-edge transformative techniques. Sikh pattern traction alopecia, we have the world's largest series of Sikh pattern traction alopecia patients. And then what we are recognized for is repair hair transplants. And last but not the least, the only clinic where a plastic surgeon does just 1 case in a day, a plastic surgeon who's wholly 100% dedicated towards hair transplant surgery. If you're suffering from Sikh pattern traction alopecia, or wonder how natural hair transplant results for the temple areas look like, this video is for you. Over 8,000 Sikh pattern traction alopecia patients have till date trusted Darling Buds Clinic for the transformation over the last 18 years. And now it's your turn. Rest assured you're in good, safe, experienced hands. At Darling Buds Clinic based in Punjab, India, we have gained a reputation for successfully treating a large number of cases of Sikh pattern traction alopecia, showcasing remarkable results that restore not only the hairline, but your confidence. The largest series you will ever see is just a click away. At the end of the video, I will share a link with you of the number of cases we have posted on YouTube here on this channel with natural results in Sikh pattern traction alopecia. In hair transplant, as you would agree, naturalness is the key. And nowhere else can it be more easily detected, if it is not, is the temple point area. The temple point area, which is so visible that it cannot be easily disguised after a hair transplant procedure. So if you want to appreciate the finesse, the skill, the artistry of a hair transplant clinic you are researching, it is the temples you should analyze, and only after that, the soft hairline, the fullness, and last of all, the crown area. So today's topic is Sikh pattern traction alopecia with special stress on temple point restoration. Most patients afflicted by Sikh pattern traction alopecia seek a corrective hair transplant more for the temple area than for the hairline. For in Sikh pattern traction alopecia, the temples are unnaturally obliterated by wearing tight hairstyles by the Sikh community with the tight top knots which we tie on the top of the head. Traction alopecia happens when the hair is subjected to constant pulling, constant tension over a protracted period of time, over many years, on the hair follicles, leading to inflammation, scarring, and eventually hair loss. In the case of Sikh individuals, our traditional practice of tying a top knot can result in significant traction alopecia. Over time, this traction can cause the hair follicles to weaken and die, leading to permanent bald spots along the hairline, along the temple points, and many times devastating the donor area as well. In Sikh pattern traction alopecia, the recipient area is badly scarred underneath due to this constant pull. At times, even the donor area is scarred. This intense scarring of the donor area as well as the recipient area makes restoration in cases of Sikh pattern traction alopecia a challenging task. It is not the usual hair transplant as in androgenic alopecia, where virgin skin is being dealt with, skin with good vascularity. One of the most daunting tasks in Sikh pattern traction alopecia is the scar tissue that you deal with, scar tissue that cuts off the blood supply, making it more difficult than androgenic alopecia to grow hair. Unlike other forms of hair loss, where follicles may still be intact and capable of regrowth, traction alopecia often results in irreversible damage. The scar tissue makes it particularly difficult for surgeons to perform hair transplant because the underlying skin may not support new hair growth effectively. Secondly, the donor area is also subjected to traction alopecia. If not traction alopecia, at least thinning of the hair considerably. And these hair can seldom be used for an effective result, an optimal result that patients expect. As you can see in this picture, this young boy with a plait running down the back, the center of his back of the donor area. So these unique challenges, both in the recipient area as well as the donor area in some cases, require a surgeon with specialized skills and experience in dealing with such conditions. And today one standout case is being presented. A young man who 7 years back came to us, walked into the clinic with Sikh pattern traction alopecia, seeking the best hair transplant solution for himself. This Sikh patient suffered from severe traction alopecia due to many years of wearing a tight top knot with unrelenting pressure, resulting in effacement of even his temple points. Before treatment, this patient exhibited significant thinning of the temple points, an uneven broken hairline that affected his self-esteem and overall appearance. After thorough consultation and assessment, we proceeded to do his procedure. The results, as you can see now, were nothing short of transformative. What truly sets our practice apart is the team's commitment to achieving natural results. In this particular case, close examination of the temple points reveals the incredibly natural result, an essential factor for patients who desire not just volume after hair transplant, but an imperceptible appearance, a hairline and temple points that even the barber cannot tell. These before and after pictures highlight how skillful placement, soft transition zones, fishtailing of the temple points, and attention to detail can make such a difference. For a patient suffering from sick pattern traction alopecia, achieving soft temple points is the icing on the cake. For temple points are a key framing element of the face, giving it definition and symmetry. In traction alopecia, where hair loss disrupts this symmetry, this harmony, restoring soft and natural looking temple points serves as a subtle yet powerful enhancement. This softness ensures a natural gradient from hairline to the temples, avoiding the sharp angles or over-projected points that can betray the artistry of the work. It's the detail in the work that ties the whole restoration together, blending form with function seamlessly. Both scenarios underscore how tailored hair restoration addresses the emotional and aesthetic core of the patient's concerns, proving that the devil is in the details. For anyone grappling with traction alopecia, especially within the Sikh community, you just need to pick up the phone and dial any of these numbers above, or email me on the email address in the description below, or just leave a missed call. Once you're my patient at Darling Buds Clinic, you're all set to embark on a rewarding journey toward regrowth with optimism and assurance that you will get a safe, effective hair transplant that will be done responsibly, and the clinic stands by the outcome and will assist you at every step and follow you up for many years to come, ensuring that you continue to have a head full of hair for a long period of time. If you have any questions about this talk about hair loss treatment for men and women, about hair transplant in India, or anything about hair transplant technique, or any question that comes to your mind, do let me know. Leave a comment in the comment section below and I'll get back to you shortly. Have a nice day and God bless you.